prepping for a VBAC, there's a couple key tips. So after first baby, if you know you want subsequent kids, a key is to start doing scar tissue mobilization, then prepping your body, so putting less stress or strain. So the big risk with a VBAC is the uterine rupturing, which can be harmful to baby if you don't get baby out quick enough. It can lead to some developmental delays if they have decrease in oxygen. So what we want to do is we want to start prepping this area before that happens. So right after a C-section, you want to start mobilizing the scar. Scar tissue on the surface looks really clean, but then below, the scar tissue gets stuck to the layers below. So if we start moving this around, this also gets rid of the C-section pouch for the people that ask this question. So I can start to take my hand over above the C-section, twist or move this. I can also skin roll, so I'm pinching what feels like your fat and then the tissue and rolling it across the C-section. I can also start to pull. So I'm trying to pull this apart, pull it up and down. We have lots of tips on this over at Expecting and Empowered, but you would want to do that right away after baby, start getting that moving 4 weeks after delivery. But if you're like, dude, I'm like too late to the game, I'm pregnant. I don't like to do that during pregnancy, but if you're pregnant, ways that you can help prep is what happens is the weight of the baby comes forward, puts more pressure on the C-section scar. So we want to go through and help change the biomechanics of pregnancy. So helping strength train the hip, the upper back to pull us back into extension a little bit, puts less pressure there. And if you're like, yo girl, I'm like literally 4 weeks out. Again, there's a lot of things that you can do with the strength training because it takes a bit. But what you want to do then is you want to know how to work it during labor and delivery. So when I am actually pushing, I'm blowing out like, and a lot of people will tell you to hold all the pressure and bear down, which is true if you're trying to create a lot of downward pressure, but also that's when, like, if there's too much pressure in the system, there can be too much tugging on the actual scar from the C-section, so you want to blow out. This is true for all labor and deliveries. You also want to learn how to relax your pelvic floor, and you're like, that thing's called the ring of fire when that baby's coming out for a reason. It hurts like holy hell. But you want to think about splaying the tissue, so getting your butt bones wide apart this way, and relaxing. I can take my hand and practice bearing down before labor and delivery so I can feel that sensation of that downward pressure in my pelvic floor. And then if you have an epidural on board, what you want to do is I would lay on your side, because if you lay on your back, you're like pushing up and over your tailbone or your coccyx to push baby out. If you lay on your side, you can pull one knee towards your chest. You just want to have somebody help you move it around a little bit, but one knee towards your chest and then pushing. That should help with tearing and less pressure on that C-section scar. If you have nothing on board as far as medication, quadruped, so hands and knees, or to even like on the bed and this, if we are in this position, this puts less pressure on that pelvic floor so that we don't have to push as hard through here. And again, it's an abdominal squeeze, relaxation here, and blowing out. So that's not like typically something that we do. So practicing it beforehand takes a lot of pressure off.